Namaskar. I am Dr. Manoj Gogoi, and I'm a senior medicine specialist from Assam. I've been practicing in Margherita for last 25 years. So I'm here to talk to you regarding connection of COVID-19 in special reference to diabetes. So we all know that these days we are in a lockdown period, and not only in India, but all over the world, everyone is in a lockdown mode. And you all know that the world is going through a pandemic of COVID-19 infection. And regarding that, I used to get a lot of phone calls from my parents, especially patients who are suffering from diabetes. So they have a lot of apprehension, and there are speculations going around that they have fear in their mind that patients of diabetes mellitus are more prone for COVID-19 infection. So my message to everyone is that, see, it's not only about type 2 diabetes mellitus, but it is about other comorbid diseases which patients suffer as they grow old. So yeah, it's true that patients with diabetes who are having uncontrolled diabetes, they are not taking good control of their blood sugar. Patients with chronic respiratory diseases like asthma, chronic obstructive airway diseases, patients with kidney diseases, patients with liver diseases, patients with cancer and other chronic nutritional ailments, these patients are at high risk of getting COVID infections. But one thing I would like to tell you right now is that stay calm, because that is the only mantra, that don't panic. Because now if your stress level or your anxiety level goes up, then especially for people who are suffering from diabetes, their blood sugar will go up. And as the blood sugar will go up, then their immunity level will also come down. So thing is that don't panic, remain calm, keep in touch with your doctor. So first and foremost, for all my diabetic patients, you try to keep your blood sugar levels under control. That's what you can do right now, because we don't have any treatment for COVID-19, and it is not in near sight. So it will take some time for medicines which are approved that they will really work, or for a vaccine to come as early as possible, but it's not going to happen before September. Now, for you diabetic people, I'll tell you that what are the things that you can take control at home. First thing, that you have to keep your blood sugar under control, and second, take your medicines at regular time. Okay, don't miss your medicines, because government has provided you all the facilities to acquire or to get your medicines from your chemist shop, because they're giving you door-to-door delivery. So you take advantage of that situation, and you should try to take your medicines on time. Now, one thing that is very important, because I'll personally prefer that you don't come to the hospital regularly for your blood sugar check. Okay, no need to come to the hospital and get yourself exposed, at risk of being exposed to COVID-19. So what you can do at home, at best, if you have a blood glucose monitor, that is a glucometer. Okay, so if you have one, then you utilize to the optimal level, or if you don't have, just get one glucometer from your nearest medical store. Now, what you can do, you can self-monitor your blood sugar at home and try to control your blood sugar. And if you find getting it difficult, then you can contact me, or you can always contact your treating physician. So try to maintain your fasting blood sugar to a level of less than 110 milligram per deciliter, which is acceptable. And try to keep your postprandial blood sugar, that is post-meal blood sugar, less than 160 milligram. Okay, that will give you good optimal control. So that's what I will suggest you right now. But the thing is that you have to regularly check your blood sugar using a glucometer. Now, apart from checking now how you're going to take control of your blood sugar, thing is that see, now it's been a lockdown period. It's more than 3 weeks now. Now we are going to have lockdown period for another, say almost another 21 days. Okay. So how long we'll be under lockdown period, we don't know. Now, thing is that now first and foremost thing is that you have to take care of your diet. So diet is very important. So now as we are all locked up inside the home, now we have a tendency to have snacks at regular interval of time. So I will ask you to whatever snacks you have right now. So you try to avoid those fried foods, those snacks which are very rich in calories, or those fast foods. Okay. So you have to avoid all those kinds of junk foods. Okay. So you can substitute if you feel hungry all the time because you have nothing to do at home now. If you feel very hungry, then you can opt for some healthy snacks. Okay. Now, what are the healthy snacks? So healthy snacks means you try to take as much as uncooked food like raw vegetables and fruits, preferably fruits. I will suggest you to have fruits that has less glycemic index. So with the fruits with high glycemic index like pineapple, mangoes, very ripe, your bananas you have to avoid. And rest of you can have assortments of all those fruits which are very low in glycemic index. And you can also have dry fruits also. And very important thing is that don't try to skip your meals at least. You have to take your breakfast, your lunch, and your dinner on time. And very important, don't binge on unhealthy snacks. Okay, so you have to take whatever the healthy snacks I have just mentioned. You can take those things, and don't binge on alcohol. Now the next thing is that regarding the physical activity, which is again very important to have a very optimal blood glucose control. So I will suggest you that now as we are in a lockdown period, you can't go out to parks or you can't go for morning walks, okay? And almost all the gyms are closed. So you'll be missing out on your physical activity. So you can do low intensity workouts like stretching at home. You can try it for 20 to 30 minutes every day. And in between your work also, you can do some stretching exercise after a certain period of time. Say after 30, working after 30 minutes, you can go for a 5 minutes relaxation. You do some relaxation exercises. Then, if possible, if you have got enough of space to move around, then you can go for 30 minutes of daily walking. So I think that will be quite good enough for you as long as your physical activity goes. Because see, it has been proved that when you stay healthy, when you do your regular physical activity, there are a lot of advantages. There's no doubt about that. Because your exercises bring down your anxiety, you'll get a better sleep, okay, and it's good for memory also. So regular physical activity is a must. And thirdly, it's very important that you get a good amount of sleep. Nowadays, I personally tell all my patients that sleep is not essential. It's a very essential thing that treat as like it's a medicine, it's a dose of medicine. Because sleep rejuvenates your body and it can cure a lot of ailments. And see, if you have a sound sleep of 7 to 8 hours, then you got a very good immunity. And it has been proved that for you to get a very good immunity, then you have to have a very good sleep for 7 to 8 hours. And one thing is that again, de-stressing your mind is very important. So time to time, you de-stress your mind by doing yoga and breathing exercise at your home. You can do very easily. And you can also engage yourself in calming activities like cooking, reading, gardening, and very importantly, it's high time to hone your hobbies. Okay, those people who are fond of writing, you can write. You can try out your writing skills. Those who want to pursue music, it's time to that you dig in between. You can play some instruments also. Okay, there are so many apps now. You can have good activity with music. There's so many apps. I could see a lot of patients engaging with themselves with Smule, and they're trying to sing a lot of songs which really distress them. And one thing is that since morning till late night, most of us are glued to TV, most of us glued to mobile phones, laptops. Okay, most of us are listening to the news, and we are really worried what is going around the world. Okay, there's so many disturbing news. So thing is that don't stick to mobiles, laptops. Okay, and just avoid before going to that, because that is going to hamper your sleep. Okay, so don't have too many lot of time on screen time. You should really avoid, and get some break from the news which you usually see now, all the news channels. Okay, just popping up every day. So try to look for some relaxing, some entertaining TV serials. And to wind up, I have few suggestions from my side. Have a positive frame of mind, because the world is going through a difficult phase, but this is not the end of the world. So we could see we have a lot of hopes um, that we will see good times, and again, the good times will again come. And please follow a healthy lifestyle and follow guidelines, whatever government has been giving you from time to time. Just follow the guidelines, what the government says. And whenever you go out, because wearing a mask is very important. Now, slowly and gradually, we are knowing the importance of wearing a mask. It's not about that only the sick people are going to wear a mask, but it's not like that. Everybody should wear a mask. Okay, and this mask will be a necessity in a future time. Okay, so buy a mask, whatever is there in your resources, get a mask and wear it whenever you go out. And social distancing is very important. And my last message is that stay at home, stay healthy, stay safe. Namaskar.